have a cracking start for you, ladies and gentlemen. None other than Professor Hans Rosling from the Karolinska Institute. Professor.
Well done. Thank you very much for allowing me to make an overview of global health. Can I have my wish? There we are. I was thinking about the European Song Festival. And I would like to start very vulgarly with the World Disease Rank List. And when we measure diseases, how bad they are, how big enemies they are, we don't count deaths. Because death is very different if it occurs in a 75-year-old person or if it occurs in a 20-year-old person. We cannot compare deaths of one disease with death of another. That's why we have to compare what says there, healthy life years lost. That's much better. Huh? And number 15 is iron deficiency. Can you imagine? It's on the list. It's the cheapest disease to treat in the world. It's rust iron tablets. And it still made it to the list. Huh? 14 is tuberculosis, diabetes, birth asphyxia, that is bad assistance or no assistance during birth, and the child gets brain damage for life or die. Depression is on place 11. 10 is traffic injury. It's climbing. COPD, it's chronic obstructive pulmonary disease. It's lungs destroyed by cigarette smoking, to put it bluntly. Preterm birth, also bad assistance at birth. If you would merge together those newborn diseases, they would almost be on top, but they are separated in different groups. Back pain. Back pain, number 7, ahead of tuberculosis. Because we measure not only death, we measure healthy life years. And everyone who have had a terrible back pain for 3 months know that half of life was lost those months, wasn't it? And there's so much suffering from back pain and from the skeleton and muscles, So they are up there. All this is from the Global Burden of Disease 2010. Recently came out, coordinated by the Institute of Health Metrics and Evaluation in Seattle. Published largely in Lancet, of minor importance, more importance, absolutely brilliant website where you can see all this. Lancet is sort of cumbersome to read all this. That's if you doubt what you see on the web, you can read Lancet. Sorry, Richard. Malaria, that's where we expect to find it. But what are the 5 big ones? And why do I have different colors? Well, in the global burden of disease, the diseases are lumped into 3 groups with terrible terms. Non-communicable diseases, all these acute or chronic diseases that has nothing with bugs to do. Like cancer, most of cancer actually, yes. And cardiac disease and so on. The disease of older age mainly. Injury is green. And red is those diseases linked to extreme poverty. Infections, maternal during pregnancy, newborn, and nutritional. So, what is now number 5? HIV, not surprising. Terribly, still there. Today, in the poor countries in Africa, low-income countries in Africa, it's only half of those who need medicine that gets it. That data is not compiled in a good way so we can see it. Half do not even get 1 tablet. That's why we still have many dying from HIV. The transmission rate is slowly coming down. Diarrhea is there. Diarrhea, the big killer. Stroke, hypertension, high blood pressure is a major global health problem today. And number 2, what is number 2? Pneumonia. So what do we have left? The winner, the main enemy we have, it's myocardial infarction, coronary heart disease in the world today. That's a success for global health. Do you understand? You don't die of diarrhea and pneumonia, you survive to get myocardial infarction. That's a step forward. I rather die in myocardial infarction tomorrow than having died in diarrhea as a child, isn't it? So this is where we are. And look, I got a vision what all these diseases are about. When I looked at this graph, what do humans do? What do humans do? Humans breathe, so they get bugs in their lungs. They eat, so they get bugs in their gut. And then they have to pump around the blood so that it reaches the brain so that we can have sex. It's really the main functions of humans, you know, that also can cause us the diseases. So we have to do all these things in safe ways and in good environments. Otherwise we can catch these terrible diseases. Now, if these are the 5 bigs for all people in the world, if you look at one age group and one sex, one gender, it's very different. And I wanted to show you young women or teenage girls, 15 to 19 here. Number 5, there's still iron deficiency. Now I get even more angry. Teenage girls should be functionally limited by not having enough iron in their diet or not getting iron tablets. Number 4 is back pain. Number 3 is anxiety disorders. Number 2 is suicide. Number 1 is depression. It points a very grim situation for young women in this world, doesn't it? And it shows how dangerous it is. If we just look at the big global burden, we have to look at specific age groups. This is for the entire world. The main cause of death in women 15 to 19 years old is suicide today in the world. And those suicide is not long depression, it's panic, it's anger, it's wrath, because they cannot do what they want with their life. They are forced by families and societies to do other things. Now, which is the big one of these groups now? If we now aggregate it, non-communicable diseases, the injuries, or those diseases of poverty, which is the biggest one in the world? Well, this is Sweden. It's all blue. You see, it's all these non-communicable. Red is only down there. Very few infections. Accidents and injuries are up there. And we have all these diseases of older age. And the dark blue are those who are increasing. The light blue are decreasing. So this one up here is decreasing. Cardiovascular and circulation. Less myocardial infarction. Cancer slowly going down. These one are increasing. What can we expect in this country? We are going to get depression when we get old. We are going to get osteoporosis. But if we get dementia, we'll forget it. It's sort of very safe to study medicine and work in health service. If we take one disease, we increase another one. But it's also much better to live to old age. And it's really difficult and it's a challenge to take care of old people in the best of ways. And that goes far beyond medicine, how you do that. This is Congo. It's all red. It's all red. It's still infections. Here infections. This is newborn diseases. This is nutritional diseases. Malaria down here is going back. That is little lighter, you know. And this is Vietnam. And Vietnam is mainly blue. They are getting control of infections. Injuries is still big, but they are now getting cancer, psychiatric diseases, myocardial infarction, problem with osteoporosis, neurological diseases. So where's the world average? Is the world average more like Congo, like Vietnam, or like Sweden? Red is infection. The poor country has a lot of infections and maternal and newborn diseases and nutritional diseases, and that decreases over here. And then these more chronic or more non-communicable diseases, they increase as you go here. Where's the world average? The world is here. Actually, it's there. This is very interesting, isn't it? If this is the world average with a little more than half blue, today the non-communicable diseases takes away more healthy years from the world population than those diseases of poverty do. This is really the progress. This is the increase of life expectancy. But they are also causing lots of suffering. It's not people living to 75 or 80 before getting myocardial infarction or stroke. They get it at 55, at 65. That's why they lose healthy life years. And they get paralysis, they get hemiplegia after the stroke. It's really suffering because they don't have treatment or the right treatment for blood pressure. So if this is in the world, Vietnam is then closer to, it's between the world average and Sweden. Vietnam, such a success story it must be in Vietnam to reach this point. And let me show you how this happened. In 1800, all the countries were down here. Each bubble is a country, the size is population. The colors show where in the world they are, in the regions here. Here life expectancy from 30, 50, 70 and 90, and here how much money they have. I want to admit one special character of me. I love money. I really love money. Because having trained in public health, I know how to use it. And I have found out that money is the best determinant of health if you use it well. If you don't use it well, it can even worsen the health situation. But if you use it well. So let's see what happened in the world. Already in 1800, richest was United Kingdom. And then the Netherlands, and then United States, and then Germany. And you see, richest was also healthiest, but they only lived 40 years. Has the world become a better place? Here we go. As years passed by, the richest got richer, and they got slightly healthier. And here Pasteur and Koch came, and the industrially produced soap and primary school, and they went gradually up. And there we are, but the countries under colonial domination were still there, and here I was born. It was a strange world. Most of the people were still down here with 40. China had 40 years life expectancy. India had 36 years life expectancy, you know. And up here was the Netherlands. This was Sweden here. And the United States was just becoming the richest in the world. And then during my lifetime, this happened. Quite fantastic, isn't it? But still, Congo is down there. And now, Norway is much richer than Sweden. It's difficult to bear. But we have to face it. But we are on par in health. Now, let me show you one thing with this. If I compare these ones, I'll do it like this. Here you have the same graph. I have Congo down in the corner here. Remember, mainly infectious diseases, maternal and newborn diseases, and nutritional. Vietnam is up there, and they are already into non-communicable diseases. It means the low life expectancy here is caused by high child mortality due to those infections, malnutritions, and lack of service at pregnancy and newborn in the poor countries. Already here, the countries are into the same diseases as in Sweden. You could say that in Vietnam, they live more like the poor, but they die like the rich. And then Sweden, lucky Sweden, 200 years of peace, we are up there. And the other countries are in between. So as you move from down there, from infections, malnutritions, and lack of delivery service and newborn service, and you move up here, you know, you get more and more chronic diseases, and up there it's osteoporosis and dementia waiting for us. Now, what does this mean for what countries have to do? It's quite interesting that when you compare Vietnam and Sweden, where do we have Sweden? Here. And I go back into history. You can see that Vietnam has been very successful in health. They got healthy at a much lower economic level than Sweden achieved the same health. They are almost world champion in health in lightweight group. That's not so much money. They can still produce a lot of health. There are countries with almost the same economic situation, like the Sudan here, like Pakistan here, like Djibouti down here, which has the same amount of money, but they haven't had the same access to school, health service, education, promotion of health, vaccination as the other countries have. Also water and sanitation have been dealt with well in Vietnam. So what does this mean for the future? Well, remember all blue there, non-communicable, mainly infections and those diseases related to pregnancies, and Vietnam in the middle. Now, this is Vietnam and Sweden isolated. Mind you, this year, Vietnam had the same economic level as Sweden had 1900. They are 110 years after Sweden in economy. 110 years. Whereas the health situation in Vietnam is like Sweden 1972. It's a 70 years difference in the health status compared to the economy. That means they run into those diseases of cancer, psychiatric diseases, strokes, at a very low income level. In fact, how much does the health service in Sweden cost? It's 10% of our gross national product. And we have Sweden today have about more than $30,000. So that means that the health service in Sweden is like the entire economy in Vietnam. So if the Vietnamese would say, we like the Swedish health service, it's sort of good. We'll provide that for our people in equity. They have no money left. No food, no clothes, no house, no nothing, just health service. And this, mind you, this is purchasing power dollar. It's not exchange rate dollar. Someone is thinking, I was in Vietnam, it was very cheap there. No, that has been taken care of. This is purchasing power amount. It's enormously what a human success we are. I would say we in health are more successful than those in economy. We should be proud of what we have achieved. We shouldn't think it's miserable today. We still have challenge enough to continue. And there are 2 billion still in poverty, which have all these red areas of infections and so on. But we have achieved a lot. But it's an enormous challenge to deal with those non-communicable diseases because there's not money for medical service. So the most important is prevention. Stop smoking. Smoking is catching up like this in these countries now. And it's causing increasing suffering every year. And if you have reached such a good health as Vietnam had, due to good public health in the past, you are obliged to continue with public health measure as your main action against the non-communicable diseases. There's no way you can start the advanced medical service as we have in Sweden. I have here in my pocket an extra hip, if I should get problem during the lecture. I have a hip here. 15,000 Swedes get a hip replacement every year. 15,000. During their lifetime, 15% of the Swedes get a hip replacement. Quite an advanced surgery. Very good results. Is this a human right? No. This can only be human right at Sunday morning. At Monday morning, it's all about budget. It costs 80,000 crowns. 80,000 crowns, $12,000. And this is very, very important to realize that the sort of advanced services we have now is only affordable if you have money. Vietnam cannot provide this. And there's a lot of people needing this all over the world. They have to be very smart and very clever in how they do at this situation. So, perhaps the most important for the countries that have got out of poverty, and that part of global health, happened in India. So I said the Global Health Action of the month was the Supreme Court of India, the 1st of April 2013. How can a court be important for health? Well, they ruled between these two persons. These are two interesting persons. Daniel Vasela has been the leader of Novartis, one of the major European drug companies. And this is Hamid Yusuf, leader of the major drug company in India. And they have been fighting about a good drug developed by... It was not planned. It would have been clever if it was planned. Yes, Hamid Yusuf, I'm here. I should have done it like that. I never thought about it. He's very angry. He said, "You're a pirate. You are making my drug." To the Indians. "I'm not a pirate. I can pay you. I respect your patent. I'm willing to pay for a license. But you're a monopolist that kill people." And it went all the way to the Supreme Court. Should he have the right to produce it? And why is it important? Because Mrs. Balam got leukemia, and Glivec, as Novartis call it, is a wonderful drug. It's those drugs, not the Me Too. It's the new smashing drugs that save people from leukemia. And it costs $60 per day. That's a lot of money. And Yusuf in Sipla, he makes it for $5 a day, and she looks much more interesting when she sees that. But count $5 a day, 300 days, $1,500, that's the income per person in India. It's still too much. Can you imagine? You lower the cost that much, it's still too much to treat it. And the government cannot afford to provide this free. It's made by volunteering actions and so on, but it's really, really a problem to deal with this. When these drugs came in Sweden, we had a better economy. We were lucky. We had an economic growth that went in the same rate as the development of medical technology. But still today, we don't get everything in Sweden. You know where the limit is for human rights in Sweden? It's here. 6 teeth, you get free titan implant. From 7 onwards, you pay yourself. It's very clear. 1 year ago, it was 5. It was moved. Human rights was improved in Sweden with 1 teeth. No country today can afford everything for everyone. So this is the global burden of disease. So why do I say that? Even if this is the biggest, this is of strategic most important. Extreme poverty is strategically of more important. And I will show you why. Look here. I have to go there. And I have to do this. And I'll do this. This. Here. And then full screen. Child mortality. 100 dying per 1,000 born. 200. 300, that's 30% dying. Number of children per woman, 2, 4, 6. 1962, Western world or industrialized countries, few children, low mortality. Developing worlds, many children, high mortality. The only intermediate was Cuba and Singapore. Otherwise, it was really 2 countries. What has happened? What has happened? Has the world improved? It's quite amazing, isn't it? It's quite amazing. Almost the whole world are down here, but Afghanistan is there and Congo is there. They're still miserable. Why is this important? It's important because 5 children are born, 1 die, 4 survive. The population of Afghanistan and Congo doubles in 20 years. It's the worst ignorance of the young Swedes we find is they think that child mortality keep controls of population growth. It's the other way around. Child mortality maintains population growth. It maintains a situation in the families where they dare not get only 2 children so that they can give them a real good life. They must have more children. And some even need daughters to go and fetch water and firewood. Extreme poverty is the worst health problem in this world. And what we are seeing here, you can see if we look inside country. Look at Ghana. Ghana looks as an African country which are down at 4 children and relatively low child mortality. If I split it in its income quintile, the richest in Ghana, you know Ghana in Africa, across Africa is very successful now. The most educated, those with better income, they are like Asia, but the worst off part, 20% of Ghana is like Afghanistan. That's in successful Ghana. You have to have several images of African countries in your head at the same time. Success in one end, enormous challenge in the other end. This is Ethiopia. I split Ethiopia. Addis Ababa today has less children per woman than Sweden. And Somali region is worse than Afghanistan. That is what in Sweden is referred to as Ogaden. Most are here in between. But Ethiopia is enormously successful. The rate of change is very fast in Ethiopia. And what do the Swedes know about all this success? We asked them about how many babies they get in Bangladesh per woman. And SCB, Statistics Sweden, asked them in 2011, and the results were this. And we, in Gapminder, where I work, we went into contact with Novos, another survey company, and said, perhaps SCB and SIDA, they asked them about aid at the same time, so they got carried away. It can't be like that, because this is far from correct. So we repeated the questions 2 years later, and it's almost the same. 2 very qualified companies did these surveys. And we had to compare. First, we were thinking about going to Norway, to compare Swedes to Norway. But we went to took the chimps instead, because Norwegian could be too tough for the Swedes. So this is the answer of the chimps. The chimps didn't understand the questions, so they had equal results. So 25% of the chimps thought it was 2.5 children per woman in Bangladesh. And this is the right answer. The chimps know 4 times more about the world health than the Swedes. I have no impact whatsoever. It's quite serious. We discuss the world without knowing it. Too much debate, too little knowledge. Not that we shouldn't debate, but we have to have a balance between knowledge and debate. And 20 years ago, it was like the Swedes thought. There's an enormous progress. There's enormous progress across the world. And this is happening with the world population. Look here what is happening. This is the world population today. Below 15, here, 15 to 30, 30 to 45, 45 to 60, and this is me up there. Europe above 60, I'm up there. Africa has very many young and fewer older. Asia, the number of children have stopped growing. In the whole world, the number of children have stopped growing. And this is what will happen. As you all know, the old will die, the rest grow 15 years older, and they get their children. The old die, and they grow older, and they get their children. They die, they grow older, and they get their children. And then this is the inevitable fill-up. There's no way we can avoid becoming 2 billion more in this world. 2 or 3 billion more, because they are already born. And there will be twice as many people in Africa as it will be in Europe in the future. This can be discussed. If poverty alleviation works fast in Africa, if family planning contraceptives is made available, if women have rights, if women have education, there will be less children in Africa. And this is not important on an environmental issue, it's important on the family level. We want people to make their own choices. It should be a right to have access to family planning. This is a human right, contraceptives. Because human rights should come with a budget. Human rights should come with a budget. If there's no budget, it doesn't work. This is the difference. Hip replacement, when you can afford this, we should see that everyone get, as they should get the vaccines and everything. We have to realize that there is a limit. Some people will live older, but that's not a very major importance. So we are 7 billion in the world, 1 billion in America, 1 in Europe, 1 in Africa, and 4 in Asia. And in 40 years from now, there will be 1 more in Asia, 1 more in Africa. And then by the end of this century, there will be 3 billion in Africa. Africa will be 3 times as big as Europe. And if you split this, you will see that the old West will just be 10% of the world population. 80% will live in Africa and Asia. The best investment option today is to buy a piece of the beach in Somalia. It's the absolutely best, If we don't have the imagination of seeing how the change will come. The sort of developing world, this is the world, it will change like this. I worked in Mozambique as a medical doctor, 1 of 2 medical doctors in a district like this. And I worked in Sweden in a district like this. And I got a traumatic syndrome for the rest of the life due to those 2 zeros. We were 100 times as many doctors in Sweden, and there were 100 times as many child deaths in Mozambique. And there were tetanus in women. That's the younger version of me there on the photo. And we had the opportunity, my wife and I, to come back 30 years later. It was a miracle how it had improved. A better hospital, but especially trained people at a level, at a professional level. There were colleagues there, not what had the possibility to get a short education during colonial time. Independence is so good, it's so crucial. But it takes time to raise from the low economic levels they are. And this is the doctor now working there. My wife said it was the only time for many years that I kept quiet for more than 1 hour just listening. He was so wise, he was specialized, he was so good, you know. He knew exactly what he could and what he couldn't do. And look, the district now had twice the population. Twice the population. But there was now 16 doctors. Doctors is not so important. I just used that. The most important was those medical assistants that were trained to do cesarean sections. You know, it was really great improvement of health service. Child death had decreased in spite of a doubling population. But when I went to the northern part of the district, there were still 300,000 people. There were still 2 medical doctors, and there was the young colleague which knew as little as me when I was there 30 years old. Poverty, extreme poverty, reproduce itself. You get 1 billion out of extreme poverty, you still have 1 billion there. You have to get it faster. We have to get extreme poverty away. This is extreme poverty. I have spent my life researching on this. I have the permission of the family to show this photo. This is the other side of Africa. You saw the success side of Africa. That's impressive. But still Africa has decades to go, and they need to get out of poverty. This is the lack of food. And to get out of extreme poverty, you know, health is a very important component. And I would jump this one here, and I would jump this one there, because I want to show you this. Universal health coverage. What is that? That is everything for everyone. But it's not possible. This is how it looks today. A few persons in the world have almost all health service they need. Most people in the world don't get most of the service they want, and the poorest 1 to 2 billion get almost nothing. Priority number 1, fill that gap. Help families get out of extreme poverty, get surviving children, get 2-child families, then deal with non-communicable diseases, mainly as prevention, and then also at cure with better pricing system of drug. This is my answer for the global health challenge. Thank you very much. Should I stay?
Yes, please.
Yeah.
Amazing, huh? I want to bow down in front of you.
I was trained in India, 1972,
Yes,
St. John's
Bangalore
Medical
man.
College. That was, you know what changed my mind?
So I have a question. As an Indian,
Yeah.
can I ask you a question? Gleevec,
Yes.
Mrs. Barlam. You
Yeah.
introduced, remember Mrs. Barlam?
Yeah.
Okay, so her treatment now costs $1,500 a year if she's lucky enough to get the Cipla drugs, and she still can't afford that, right?
Yes.
So what are you saying then, Professor Rosling? Should Sweden be limiting the number of hip operations and saving that money and sending it to India for Mrs. Barlam and others with leukemia? What are you saying? How does everyone here help Mrs. Barlam?
Economic growth in India. The only thing that we can handle cancer by treatment and we can get hip replacement is economic growth. That's why I love money.
Okay.
And India is growing, but India also have to use its money rational now. You have to. We've seen a lot of Indians where you can recover more taxes, but that's not enough. They have to have it. So Mrs. Barlam, with that sort of treatment, will still depend on donations. But donations have to come within India for that. The world should continue to assist India with vaccines, contraceptives, the basics, so that can reach out in the rural areas. That's the most important.
So Sweden's aid money doesn't go to Mrs. Barlam?
No.
Okay.
I don't think that is relevant, because there's much more important. At present,
So this is another question from the audience. Sorry to interrupt. It's from Susan Martin. Thank you if you're here. Where are you? Yes? I hope you're here. Hi, Susan. So her question is, so Hans, With the money available, what should we be tackling first then, which is what you were about to answer? And will we need to plan long-term interventions?
I asked the Minister of Health in Vietnam 15, 20 years ago, how can you be so healthy when you are so poor? And she answered, grandmother can read. It's absolutely amazing. Half of the fall in child mortality can be explained by female literacy.
Okay.
And mind you, the mean number of years in school for men in the world is 8, and for women it's 7. It's in the poorest countries where girls don't go to school. We have to get everyone to school. Of Swedish aid money today, the only thing which is allocated for primary school is 1%. 1%. Get children into school. See, I go outside health.
So
first.
even more important than vaccines is education
Yes,
then?
electricity. Electricity lowers child mortality as much as vaccine. But then the basic preventive service, vaccines, treatment for the major infectious diseases, a better newborn care, and assistance for women during pregnancies, and access to contraceptives. Did they fall down here? Where are the contraceptives, you know? Which India has done. India now has 2.4 children per woman, and the number of children below age of 8 is not growing any longer in India.
In the south?
In India, the 1.2 billion mighty country, which will be the leading nation in the world because it's the biggest country that speaks English.
Well, let's hope. I mean, at any
No,
rate,
no, it's going that way. It's going
there's
that way.
There's a row for international moderators from India who speak English. Let's hope there's a row for 1.2 billion people in this world. Hans Rosling, we have one more follow-up question, which is there any other way than economic growth, as it may conflict with the idea of sustainability? And that comes from Victoria Linden.
Economic growth pays for school teachers. Economic growth pays for cesarean sections. Economic growth pays for electricity and all the way to washing machines. That the whole world will ask for. There's not one single person here that hand wash their sheets and their jeans. That's where everyone will reach for. It's the richest 1 billion that has to use resources so they can be shared that way by all 10 billion. It's the richest 1 billion that should change first. And they have to change partly by behavior, partly by more efficient energy use, and partly by inventing new energy sources which are green. This is the change that happened. Don't ask others to hand wash and stay out of school in order for yourself to do nothing.
Very clearly put. Professor Rosling, thank you so much for getting us going.
Thank you.